This is me Arzu here and I welcome you to my channel Mr. Teeth, where your dental concept get dissected. So this is our first video on the alveolar bone, and today we are going to start this new chapter of the dental histology. Okay, so in the previous video we have discussed about the oral mucosa. Okay, so we have completed with the total 6 chapter of the dental histology till now. From today we will start this new chapter, alveolar bone. Okay, and we will also complete this chapter of the dental histology. Okay, and in this first part of the alveolar bone we will be discussing with the introduction and the classification of the bone, and the composition of the alveolar bone or the bone. Okay, so now without delaying much, let's start our today's video. Okay, so in the first line, okay, as I have written here about the alveolar bone. Okay, introduction to the alveolar bone. So alveolar bone, okay, I think everyone is familiar with this term alveolar bone. Okay, so this is the defined as the part of the maxilla or the mandible that form and support the tooth socket. Okay, so this is a part of the maxilla or the mandible. Okay, so we have maxilla and the mandible forming the upper jaw and the lower jaw, and those alveolar bone are the parts of those bones. Okay, and they forms the socket in which the tooth is lodged. Okay, so that is called the alveolar bone, and they forms with the eruption of the teeth and provide the osseous attachment to the forming periodontal ligament. Okay, and also they disappear with the loss of the tooth, so they are tooth dependent bony structure. Okay, so alveolar bone, okay, so they are formed when there is eruption of the tooth. Okay, and when there is a loss of the tooth. Okay, so there we can see the resorption of the ridges. Okay, so we can see the ridges is resorpted. Okay, in the patient with the in the patient. Okay, in old age patient we can see the all the ridges are resorbed. Okay, there is a loss of the tooth. Okay, and that loss of the tooth cause the resorption of the ridges. Okay, so this is very important line. Okay, so this is a tooth dependent bony structure. Okay, so if there is tooth then it will grow, if there is no tooth then it will be lost. Okay, and about the functions of the alveolar bone we will be discussing in upcoming videos, but now, okay, we will discuss with the classification. Okay, so in the classification, so we have classified alveolar bone on 3 different bases. Okay, so one is on the shape, another is on the development, and another is on the microscopic structure. Okay, so based on the shape, okay, so we have long bones, short bone, and we have flat bone and the irregular bone. Okay, so first we will start with the long bone. Okay, so I think it is very easy to understand. So long bones are the long and slender. Okay, and they are longer than they are wider. Okay, so the width of the bone, okay, the width of the bone is less and the length of the bone is longer or larger. Okay, after that, tubular diaphysis or the shaft, which is made up of the compact bone at the periphery and the surrounding central medullary cavity containing the yellow marrow. Okay, so this is very important, and this is general structure. Okay, so I'll draw the schematic diagram of the bone. Okay, so this is the bone. Okay, I think we have seen this a lot of time. Okay, so this is the epiphysis and this is the diaphysis. Again, this is the epiphysis. Okay, so in this diaphysis there is a tubular diaphysis. Okay, so this is tube, and also we call it shaft. Okay, shaft of the bone. Okay, so which is made up of the compact bone at the periphery. Okay, so at the periphery, so if this is a cross section of the diaphysis, then we can see the compact bone at the periphery, and we can see the central medullary cavity, okay, in the middle, okay, which contains the yellow marrow. In this portion we can see the marrow, okay, and surrounding there is a compact bone. After that, 2 bulky ends, that is epiphysis, have the compact bone at the periphery and the spongy bone at the center. Okay, so now in the diaphysis, in this epiphysis, okay, so we have again the I am drawing just the cross section. Okay, so just resemble this portion I have taken. Okay, so I have cut the bone at this side. Okay, and we are looking from above, and we can see the compact bone at the periphery, and in the middle, okay, we can see the we do not see the medullary cavity here. Okay, but we can see the compact bone is present there. Okay, so we can see the compact bone Okay, so compact bone is present in the middle. Okay, so this is present at the epiphysis and this is present at the diaphysis. Okay, and I think you are familiar with this. After that, between the epiphysis and the diaphysis, we have epiphyseal line or the plate. Okay, actually the epiphyseal plate is a residual of this epiphyseal line. Okay, but you just take concept that there is epiphyseal line or the epiphyseal plate. Okay, that is present between the epiphysis and the diaphysis. Okay, and this epiphyseal plate is very important in the growth of the bone. Okay, so I think you have studied about this in the general anatomy. Okay, so they are important in the growth of the bone. After that, examples. Okay, so we have femur, tibia, fibula, humerus. Okay, so they are the long bones. After that, in the short bones. Okay, so they are a cube shaped bone, nearly equal length and the width, and contain spongy bone at the center, covered by the thin compact bone at the periphery. Okay, so the structure is quite similar with that of the epiphysis. Okay, so epiphysis also do have compact bone at the periphery and the spongy bone at at their center. Okay, so the similar structure is there in the short bones. After that, bone marrow is absent here and but is present here. Sorry. Okay, so bone marrow is present here. Okay, sorry, so it is present in the short bone, but there is no marrow cavity. Okay, but the marrow cavity was present in this long bone, and also the bone marrow was present. Okay, that is yellow marrow was present in the long bone, in the diaphysis portion. Okay, but it was absent in the epiphysis portion, and here too. Okay, so bone marrow is present but no marrow cavity is there. Okay, so this is very important thing to remember. After that, in examples, okay, we have carpals and the tarsals. Okay, and tarsals are on the ankle. Okay, and carpals are on the wrist. Okay, so they are the short bones. After that, we have flat bones. Okay, so flat bones are thin, flat, curved with a no marrow cavity. Okay, so here also we can see the marrow cavity. After that, spongy bone is present between the upper and the lower layers of the compact bone. Okay, so this is upper layer and this is the lower layer, and in between them, okay, in between them we can see the spongy bone. Okay, so here is the spongy bone. Okay, so this is the spongy bone here. Okay, so that is the structure of the flat bone. After that, in example, sternum, ribs, clavicle, scapula, parietal bone, frontal, temporal bone are the examples of the flat bone. Okay, so I think I think this. Okay, so there is two tables. Okay, so those tables are resembling the upper layer and lower layer. Okay, and those in the skull bone. Okay, so in this parietal frontal bone we see the tables. Okay, so there is a technical term called we call that. Okay, so we have two tables. Okay, and in between the tables we can see the spongy bone there. Okay, so it is a bit similar. Okay, so now in the examples, sternum, ribs, clavicle, scapula. Okay, so they are flat. Okay, so this scapula is flat, clavicle is flat. Okay, ribs is flat, sternum is also flat. Okay, so I think you can relate all those points. After that, in our fourth type, okay, so that is irregular bone. So there we can see the complex and irregular shape. Okay, so they are complex and irregular, made up of the spongy bone which is covered by the compact bone thin layer. Okay, okay, so it is also made up of the spongy bone which is covered peripherally by the compact bone, and marrow cavity is absent here but bone marrow is present here. Okay, so marrow cavity is absent in the irregular bone and bone marrow is present. Okay, so which is also similar with that of the short bone and also with that of the flat bone. Okay, after that, in examples, okay, so we have vertebrae, facial bones, ethmoid, sphenoid, pelvic bone, ischium, pubis, and mandible. Okay, so this mandible is important to remember. Okay, so mandible is a irregular bone. Okay, so now we have completed the classification of the bone based on their shape. Now we will move to the classification based on their development. Okay, so in the first we can see the endochondral bone, and our another type is a intramembranous bone. Okay, and also we have another type, that is sesamoid bone. Okay, we will be discussing with this. So in endochondral bone we can see that they are formed by the replacement of the hyaline cartilage with the bony tissue. Okay, so endochondral bone means they are formed by the ossification. Okay, so ossification is a process of formation of the bone. So there is a ossification in the cartilage. Okay, and hyaline cartilage there is a ossification. Okay, so that forms the endochondral bones. After that, it occurs in the bones of the trunk and the extremities. Okay, so they are the examples of this endochondral bone. After that, in intramembranous bone, they are the replacement of the sheath like connective tissue membrane with the bony tissue. Okay, okay, so in this intramembranous, okay, so there is the ossification in the cartilage, and here is the ossification in the sheets of the connective tissue membrane. Okay, so in the connective tissue membrane we can see the ossification, okay, that forms the bone. After that it occurs in a cranial, facial, flat bones of the skull, mandible and the clavicle. Okay, so again mandible is important here. Okay, so in the cranial facial region, okay, so the most of the bone are from the head and neck region. Okay, in the head. Okay, so it is important for us. Okay, so intramembranous bone ossification is important for us. So it occurs in a cranial and a facial flat bones of the skull, mandible and the clavicles. Okay, and now another type is a sesamoid bone, and it develops in the tendons where there is a considerable pressure, okay, tension or the friction. Okay, an example is a patella, and I think you know this about the sesamoid bone. Okay, so patella or the kneecap. Okay, so it is a sesamoid bone. Okay, it is developed from it is developed in a tendon. Okay, due to the considerable pressure, tension and the friction on that tendon. After that our third basis is on the microscopic structure. Okay, so in the microscopic structure we have classified the bone into the mature bone and in the immature bone. Okay, and also in the mature bone we have a compact bone, that is also called cortical bone, or the cancellous bone, also called the spongy bone. Okay, so which we have discussed earlierly. And we have another immature bone or the Orban bone. Okay, so first we will discuss with this mature bone. After that we will discuss with the immature bone. So in the mature bone, okay, so we have compact bone first, or the cortical bone. Okay, so it consists of tightly packed osteons or the Haversian system. Okay, and I think you are familiar with this osteon or the Haversian system. Okay, so this is taught mostly in the general anatomy. Okay, so this is consist of the tightly packed osteons or the Haversian system forming a solid mass. Okay, so we can see the solid mass formation there, and also called the lamellar bone. Okay, so compact bone or the cortical bone, it forms the periphery of the diaphysis. Okay, and most of the bones periphery, okay, it is formed by the compact bone, and they have the more developed, okay, and packed osteons or the Haversian system. Okay, so they have tightly and well developed Haversian system is present in this compact bone or the cortical bone. After that we have cancellous bone or the spongy bone. So honeycomb appearance is there. Okay, and large narrow cavities and the seats of the trabeculae of the bone in the form of the, okay, bars and the plates. Okay, so honeycomb appearance is there. Okay, just like, okay, this is the cross section, then we can see, okay, so this is a honeycomb appearance. Okay, I will be showing picture now. Okay, so we can see the honeycomb appearance there. Okay, large narrow cavities are there, but seats of the trabeculae of the bone in the form of the bars and the plates. Okay, so that is under this mature bone. Okay, so now we will discuss with the another type, that is a immature bone or the Orban bone. Okay, so it is first formed bone with the irregularly oriented collagen fibers of the varying diameter. Okay, so this is the Orban bone or the immature bone. Okay, so they are, the name signifies, okay, so they are immature and they are found in the infancy stage. Okay, so I have written it here. Okay, so they are not seen usually after the birth, but they are present in the infant stage. Okay, and the line that is present here, okay, so this is important. Okay, so they are mostly seen, okay, in the alveolar bone and after the birth too. Okay, and also during the healing of the fracture. Okay, this is important for the MCQ exam. Okay, after that this is a rapid forming bone, so it incorporates the many osteocytes. Okay, so in this picture, as you can see, this is a picture of the long bone. Okay, so we can see the epiphysis there, diaphysis and epiphysis again. Okay, and spongy bone is shown there in the middle of the epiphysis, and we have a medullary cavity in the middle of the diaphysis. Okay, and at the both the end we have articular cartilage. After that we can see the picture of this flat bone. Okay, so we can see the this is a cross section of the parietal bone. Okay, parietal or frontal, I think. Okay, so we can see the compact bone on both the upper and lower side, and we can see the spongy bone in between them. Okay, so those compact bone are called tables in the technical term. Okay, so the two tables in between we have diploid, and which is a spongy bone. After that, in this picture we can see the difference between the Orban bone and the lamellar bone. So in the lamellar bone we can see the proper structure. Okay, so there is a proper osteons present. Okay, lamellar it is a lamellar bone, okay, cortical bone. So there is a presence of the proper Habersian system, over osteons are present there. But in this another picture we can see there is a disorganized, okay, so anything is not properly developed there, okay. We can just see small osteocytes there, okay. So that is the immature or the Oben bone. And as I have told you that immature or the Oben bone is present just in the infant stage, okay. It is not present after the birth, but in the cases of fracture and also in sometimes in alveolar bone, okay, we can see this we can see this Oben bone, okay. So okay, so we have discussed with the classification of the bone. Now we will discuss with the composition of the bone, okay. And in the composition, as we have prepared a table here, so this table is important, and when you draw this table in your exam, theory exams, okay, so it will be good there, okay. After that, now let's discuss our this table, okay. So alveolar bone, we have inorganic contents and the organic content, okay, but mostly we have the inorganic content, okay, as it is the bone. After that, in inorganic content we have 67 percentage, okay, of the inorganic content, and the organic content we have 33 percentage. Inorganic content we have hydroxyapatite crystals, okay, mostly that is the formula is written here, C18 BO4 all 6 and hydroxyl ion whole 2, okay. And organic content we have collagen and the non-collagenous protein, okay. And the collagen we have 28 percentage, okay, so it is 28 percentage here. And in the non-collagenous protein we have 5 percentage, okay, and that will form the 33 percentage. After that, in the non-collagenous protein, it contains the bone shallow protein, okay, osteocalcin, okay, osteonectin, proteoglycan, okay, growth factors and the cytokines, okay. So growth factor we have a different kind of growth factor, okay, platelet derived growth factor, okay. So that is the example of the growth factor. So we have discussed with these growth factors, okay, in many chapter, also in the cementum chapter, also in the periodontal ligament chapter, okay. So they are bit similar in every portion of the chapters, okay, every chapters of this dental histology, okay. So now in the mineral component hydroxyapatite, okay, with the carbonate content is high, okay, with the carbonate content, and the low calcium by phosphate, okay. Your calcium by phosphate ratio is low, okay. So this is important for your MCQ exam. After that, small amount of the calcium and the phosphate are also present here, okay. The small amount of the calcium and phosphate is also present, okay. So this is a line of the Orbans. After that, bony crystals are in the form of the thin plates or the leaf-like structure. They are packed closely with a long axis nearly parallel to the collagen fibers, okay. So those bone crystals, okay, so these hydroxyapatite crystals are in the form of thin plates or the leaves like structure, okay, and they are packed closely in the long axis parallel to the collagen fibers, okay. After that, in another point, ions present are calcium phosphate, hydroxyl ion, carbonate ions are present there. Citrate, magnesium, sodium, potassium, iron, lead are also the elements, okay, or they are present in this small quantity, okay. So they are the metals, okay. So citrate, magnesium, sodium, potassium, iron, lead, okay. So this iron, lead are present in this bone, okay. After that, in organic portion, okay. So in organic portion we have type 1, type 5, type 3 and type 12, okay, collagen present in the alveolar bone. And type 3 and type 12 collagen are produced by the fibroblast, and type 1, 5 and 12, okay, it is produced by the osteoblast, okay. So this is the synthesis of those collagen, okay, and this is important for a MCQ exam. So 1, 5, 3 and 12, okay. So you can remember this, okay. So 1, 3, 5, 12, 1, 3, 5, 12, okay. So that is the types of the collagen that is present in the alveolar bone. After that, in the next one, due to the collagen fibers, okay, matrix of the bone appear to be red to pink in HN histine, okay. So due to those collagen fibers, okay, the matrix of the bone, okay, when they are stained with the hematoxylin and eosin stain, they appear red to pink, okay. After that, in the non-collagenous protein are secreted by the bone cell, so called the endogenous proteins, okay. So they are mostly secreted by the bone cell, but also sometimes they are coming from outside, okay, like albumin, okay, they are also present in this bone and they are secreted from the blood, okay. Mostly this albumin is particularly being secreted in the liver, okay, and they are present in the blood, okay. So this is a blood protein and it comes in the bone, so they are the foreign for the bone, okay. They are not secreted by the bone cells there, okay. So the protein that are mostly secreted by the bone cells are the endogenous protein, and mostly these endogenous proteins are the non-collagenous proteins. After that, 25% of the non-collagenous protein is the osteonectin. Okay, so this is important non-collagenous protein. After that, lysyl, okay, lysyl oxidase and tyrosine rich acidic matrix protein, okay, tramp. Okay, so this can be asked in MCQ exam, is important component of the demineralized bone matrix. Okay, so now we have completed our first part of this chapter, alveolar bone. Now we will move to the another part. Okay, and we will be discussing further in this chapter. So we will meet in the next part of this alveolar bone. Till then, stay happy, stay healthy, and tata, bye bye, thank you.